Okay, I'm here to. So I got some question. According to the American Heart Association, 5 people have some form of coronary vascular disease. 1 pip. So how about dyspnea after laying down for several hours? There will be a paroxysmal nocturnal dyspnea. So what are the 7 serum marker for the myocardial damage? It's gonna be the troponin, creatinase or CKMB. There will be a myoglobin, serum lipids like cholesterol, triglyceride, HDL, LDL, uh, homocysteine, C-creatinine protein, or blood coagulation tests like PT, PTT, INR. What are the hemodynamic monitoring? So the hemodynamic monitoring, is there any disorder involving the stasis of the blood in the lower extremities as a result of the obstruction and reflex of the venous valve, causing the blood to collect and stagnate in the lower legs? Is there any venous insufficiency? Okay. What do you call this disorder resulting from prolonged venous hypertension which stretch the vein and damage the valve? It's called venous insufficiency. So what is the classic sign of chronic venous insufficiency? Should be tan copper skin. How about a special gauze, usually 4 inches in wide and 10 yards, which can be used for the treatment of venous stasis ulcer and other venous insufficiency of the leg. It can be used as a supportive bandage for spraying and strain of the foot, ankle, and lower leg. It's called Unaboot. So what are the 3 points to Virchow's triad? Stasis of the blood, vessel damage, increased blood coagulability. So how about what are the formation of the blood clot on the wall of the vein, inflammation and obstruction of the venous flow often to accompany a venous thrombosis which form in deep vein, superficial vein. It's called thrombophlebitis. So what is the most common symptoms of DVT? Calf pain with walking, or however, Homan signs unreliable indicator. So it's called Homan signs. So what test measure blood flow through vein? It's plethysmography. What thrombolytic drugs uses tissue plasminogen activator to accelerate clot lysis? It's called streptokinase. What anti-inflammatory disease of the peripheral arteries accompanied by thrombi, inflammation, and vasospasm of the arterial segment affecting men under 40 who smoke? It's called Buerger's disease, also known as thromboangiitis obliterans. What is the persistent elevated systemic blood pressure with no known cause? It's called essential hypertension. What is the first choice of drug in a single drug therapy for a client with hypertension? It's called diuretics. What drugs interfere with aldosterone to decrease blood volume and decrease vasoconstriction? Used initially for patients who are diabetic, have heart failure, or history of MI. It's ACE inhibitor. Um, Lotensine, Capoten, Basotec, and Monopril are example of what antihypertensive medication. It's called ACE inhibitor. What drugs preventing beta receptor stimulation in the heart decreases the heart rate and cardiac output in contractibility? It's called beta blockers. So tenormin, Lopressor, Corgard, Inderal, propanolol are example of what kind of antihypertensive medication? It's called beta blockers. What medication decrease vasomotor tones to cause vasodilation and thus reduce blood pressure? It's alpha blockers. Cardura, Minipress, and Hytrin are example of what antihypertensive medication. It's alpha blockers. What medication inhibit the flow of calcium across the cell membrane of the vascular tissue and cardiac cell, causing vasodilation? It's calcium channel blocker. What is Norburst, Cardicem, or what example of antihypertension? It's calcium channel blocker. Arterial aneurysm are the most common in men in what age group? Men over 50. What is a sudden obstruction of debris, thrombus, plaque, masses, bacteria, bone marrow, fat, cancer cell of the artery? It's acute atrial embolism. What is the chronic disease of the arterial system characterized by abnormal thickening and hardening of the vessel wall? Arteriosclerosis. What is the formation of arteriosclerosis, in which deposit of fat, fibrin obstruct and harden arterial vessel? It's called arteriosclerosis. What is slow progressive obstruction and hardening of the arterial vessel that impairs circulation and decrease blood supply to the peripheral tissue? It's called peripheral arteriosclerosis, or PBD. What disease usually affect people in their 60s and 70s? Diabetes, elevated cholesterol, and smoking. It's called peripheral vascular disease. What is the term for muscular pain in the legs that occur with predictable level of activity relieves in rest? It's intermittent claudication. So